Miss Jones, how are you?
I'm well. How are you?
Good. Good to see you again.
You too.
So I haven't seen you since last time you were here when you found a small lump in your breast. So after that, we sent you for the diagnostic mammography. Didn't show any abnormal tissue, but from what I understand, the lump is still there, getting a little bit larger and a little bit painful.
Significantly more painful.
Okay. So I'm glad you came back. You did all the right things. So I'm going to go through a quick assessment, just kind of a head-to-toe assessment. We'll talk about some things, and then we'll talk about next steps. Okay. I want to go over your history a little bit. Hypothyroid, are you still taking your thyroid medication?
Yep, every morning.
Great. And pyelonephritis and urinary retention, you had episodes of both in January. Any further concerns?
No.
Okay, great. And only surgical history I have is colonoscopy in May, and then in June you had ovarian surgery, is that right?
Yeah, I had some polyps removed.
Perfect, okay. As far as your family history, I see that your mother had breast cancer at age 37. Okay, is your mother still alive?
No.
Okay. And your maternal aunt had breast cancer at age 57. So you do have a pretty strong genetic component here that could potentially cause something like breast cancer. So I'm glad that you're making all the right steps early. You've done everything right. As far as social history goes, you have you used to smoke cigarettes, but you quit about 25 years ago.
At least, yeah.
Perfect. And no smoking since then.
No.
Okay. Smoking can contribute to breast cancer, to acquiring breast cancer. So I'm glad that you stopped. And then social drinking, just occasional 1 or 2 glasses of
holidays. Maybe if we go to a party or something. Yeah.
And that's never been an issue for you? Okay, that can be another cause. So, and no illicit drug use or even medical marijuana?
No.
Okay, great. So let's get to our assessment. The first part of the assessment is just a general survey. I'm going to do a head-to-toe assessment of all your symptoms. I'm looking for things that may be affected by the aging process that are normal, and then I'm going to look for some abnormalities as well, okay? First, I'm going to listen to your heart, so you can just relax. Okay. Okay, I'm going to listen to your lungs, so if you could take some deep breaths for me, in and out. Again. Again. One more time. Perfect. All right. Feel your pulses real quick. I'm going to shine a bright light in your eyes for just a minute, okay? Just follow the light. Perfect. Okay, so your lungs sounded good. I didn't hear any fluid buildup in your lungs. Can you stick your tongue out for me? Perfect. Smile. Great. Shrug your shoulders. Okay, everything looks good. I didn't hear anything in your lungs. Everything sounded good. Your heart sounds normal. I didn't hear any arrhythmias, or you ever had any heart murmurs or anything abnormal?
Not that I can remember. Not that a doctor's ever told me.
Okay, it sounds good to me. Your skin all looks good. I don't see any bruising or skin tears or anything that I would be concerned about. You're not on any blood thinning medication, so I wouldn't expect to see that. Heart rate's good and strong. Your respiratory rate is great. Your vital signs looks good. You looked great. Your blood pressure was normal. Anything concerning about any of those things that you've noticed on your own time?
No.
Okay, so your neurological assessment was fine. I'm going to have you do what's called a tug test, the get up and go test. So I'm looking for neurological deficits as well as musculoskeletal deficits. So I'm going to make sure that you're able to get up, walk about 3 meters, pivot back, and sit down. I'm going to be looking for how long it takes you. So go ahead and sit in the chair here. Take it out of your way. When I say go, I'm going to have you get up like you normally would. Don't rush, and walk at a normal pace that you're comfortable with. About 3 meters up till you see the mark on the floor. Pivot and turn around and sit back down. The timer will stop when your back is up against the chair.
Okay.
Okay? You don't use a walker or anything, a cane.
No.
Okay. I'm going to do the test 2 times, and I'm going to average those 2 scores, and that's how we'll get your tug score. Okay? You ready? Okay, go. Perfect. Ready to do it again?
I think so.
You need to catch your breath? I know it's exhilarating.
I think I'm okay.
Okay, go. Perfect. Okay, so your average between the two scores was 12 seconds, which puts you right in the normal range. So I see no deficits there for musculoskeletal ambulation, no neurological deficits. So that's all great. If you want to go ahead and have a seat back on the table, we'll keep going. How has your GI been? Any issues with stooling? Any abdominal pain or concerns there? How often do you have bowel movements?
Every day.
And they're pretty regular. Okay, great. And then what about, we talked about the urinary issues that you had before, and you said you no longer have the retention issues. Have you had any other issues, incontinence or foul-smelling urine, frequency issues?
I've had some stress incontinence if I let my bladder get too full and I sneeze, or if I have a coughing fit or something, I have a little bit of loss, but.
Okay, that's all normal part of the aging process. Your skin looked good. As far as a psychological assessment, I gave you the geriatric depression scale, which you filled out before you came in. Based on your score of 4, I have no concerns about depression with you. How do you feel in that regard?
I'm not depressed. This has me a little shook up, but more from the, I just want to get it dealt with and move on.
Sure, sure. How about your support system?
I live with my husband still, and he's always been wonderful. Very
Is he
supportive.
pretty active still and able to kind of
yeah.
be involved in your care?
Yeah.
Okay, excellent.
He's very active. And I have 2 kids. Neither of them live in town, but they come and visit at least once a month, both of them. And if I needed anything, I know they would be here.
Excellent.
So.
That's what I like to hear. Any spiritual resources that you use?
My husband goes to church every Sunday, but I usually use that time kind of like alone time. I prefer to go for a walk or
that's
sit outside and enjoy the weather.
That's enough spiritual healing for me, I think. I think that's great. Okay, so you do have some risk factors that we talked about. You have the genetic issues. One thing that we didn't address is your weight. Your BMI is pretty elevated. Excessive weight can be a contributing factor for breast cancer. So I'm going to give you some resources for a healthy lifestyle. We'll get those for you when you check out. Just some, maybe walk, like you said, you walk for some spiritual relief. So maybe you can walk a little bit with your husband or even by yourself to work on getting your BMI down a little bit, because that is a risk factor for breast cancer.
It's because my husband's a good cook. It's always been a problem since we got married.
I have the same problem. He's trying to be helpful, I understand, but sometimes it's a problem. So that's all I have for you. I did, when you first came in, I palpated your breast myself. I definitely feel the lump. I was not able to feel it on your last admission. This time I definitely feel it. I also noticed around your nipple there's some dimpling of the skin. That can be a cause of, that can be a symptom of breast cancer as well. I don't want to alarm you, but these are things we need to be aware of. I don't see any size differences, and I was not able to elicit discharge from either nipple, so that's a good thing. So the next step here is we're going to send you for a screening mammography. It's much like the diagnostic one that you already did, a little longer and a little bit more intense, just to look for really dense tissue and anything abnormal. Based on that, we may go ahead and do a needle biopsy, small outpatient surgical procedure, just to kind of see what we've got going on there in that lump. Okay, we want to do this pretty quickly. You came in early, like I said, so you've got that going for you. So we're in good shape as far as that goes. Any questions that you have?
No, my girlfriend had kind of warned me about the needle biopsy, and I sort of anticipated that that's what would need to be done. And I would rather, sooner than later, would rather just find out whatever it is and get a plan. And
good. That's exactly the right train of thought, and it sounds like you have a great support system. So if you have any questions, you have my number. Please call me. Please call the office. On your way out, we'll get you those healthy lifestyle packets that I talked to you about, and we'll get that screening mammography scheduled, and then I'll be following closely with the mammography technician for all the results, and we'll get you good care, okay?
Great, I appreciate it.
Okay, thank you, Ms. Jones.
Thank you.
Thanks for coming in.